Assalamu alaikum, ladies and gentlemen. First of all, let introduce myself. My name is Haider Ali. I am student of MS Chemistry at University of Management Technology. I am going to explain my presentation topic to Dr. Hammad Majeed, HOD Chemistry Department at University of Management Technology, Sialkot. My topic of presentation is risk factors of pancreatic cancer in patients with type 2 diabetes mellitus. The table of contents include abstract, introduction, general intro of pancreatic cancer, relationship of T2DM with pancreatic cancer, type 2 diabetes mellitus as a risk factor of pancreatic cancer, type 2 diabetes mellitus as a sign and consequence of pancreatic cancer, and pancreatic cancer as a cause of T2DM. Mechanism of diabetes mellitus associated pancreatic cancer, IR and hyperinsulinemia, hyperglycemia, chronic inflammation. The part of discussion includes relation of drug therapy for T2DM and pancreatic cancer, metformin therapy, insulin therapy, conclusion, and last one is references. First of all, let's discuss about the abstract of article. Pancreatic cancer is a devastating and harmful disease, and it is well known that there is a complex bidirectional relationship between pancreatic cancer and type 2 diabetes mellitus. In order to more deeply summarize the relationship between them, this article summarizes the epidemiological data on the relationship between pancreatic cancer and the type 2 diabetes mellitus and further explains the mechanism of interaction between them. Meanwhile, it also summed up the effects of drug therapy for T2DM and pancreatic cancer and impact of type 2 diabetes mellitus on surgical resection of pancreatic cancer. About 80% of the patients with pancreatic cancer have glucose metabolism alterations, thus suggests an association between type 2 diabetes mellitus and pancreatic cancer risk and progression. The use of diabetes medications can influence the extent of carcinogenesis of the pancreas. The longest duration of diabetes mellitus may reflect hyperinsulinemia due to treatment of hyperglycemia. But recent onset diabetes was associated with increased risk for pancreatic cancer due to hyperinsulinemia and hyperglycemia. In conclusion, the review demonstrates the type of type 2 diabetes mellitus and the duration of diabetes pose a risk for pancreatic carcinogenesis and that there is a biological link between the diseases. But increasing epidemiological data points out that pancreatic cancer also acts as a cause of type 2 diabetes mellitus and new onset type 2 diabetes mellitus is sign and consequence of pancreatic cancer. Insulin resistance, hyperinsulinemia, hyperglycemia, and chronic inflammation are the mechanisms of type 2 diabetes mellitus associated pancreatic cancer. At last, you can see metformin decreases the risk of pancreatic cancer while insulin therapy increases the risk of pancreatic cancer as comparison to the metformin therapy. Let's move to the introduction part. Pancreatic cancer is one of the most devastating and lethal malignant disease is the harmful disease because of its high rate of advanced stage diseases at diagnosis and its resistance to the therapy. Worldwide, the estimated incidence and the mortality of the pancreatic cancer is the general population of nearly 8 over 1 lakh persons a year and 7 over 1 lakh person per year, which is significantly higher in the United States than in the rest of the world. The American Cancer Society estimates that in 2018, about 5,05,440 people, consisting of 29,000 males and 26,000 females, will be diagnosed with pancreatic cancer, and about 44,000 people will die from it in the United States this year. Pancreatic cancer was associated with a very poor prognosis with the 5-year survival rate of less than 10%. Meanwhile, it was 3% in the United States due to the high recurrence rate even after potential curative resection. The 5-year survival of completely resected patients was only up to 25%. Current treatment modalities were surgical resection, adjuvant therapy, neoadjuvant therapy, palliative therapy, targeted therapy, and the novel therapies. Among them, surgical resection was the mainstay of treatment and the only potentially curative therapy for pancreatic cancer. Diabetes mellitus is a group of metabolic disorders of multiple etiologies characterized by chronic hyperglycemia and with disturbances of carbohydrates, fats, and protein metabolism. Let's discuss about the relationship between pancreatic cancer and T2DM diabetes mellitus. The relationship between pancreatic cancer and type 2 diabetes mellitus is complex and bidirectional. Pancreatic ductal adenocarcinoma, the most common form of pancreatic cancer, has been thought to be more related to the diabetes mellitus, as American Cancer Society Cancer Facts and Figures 2013 stated about 25% of the patients had type 2 diabetes mellitus at the time of diagnosis of pancreatic cancer, and roughly another 40% had prediabetes. Besides, a total of 50% increased risk was observed in pancreatic patients with long term less than 5 years type 2 diabetes mellitus. Therefore, the relationship between pancreatic cancer and diabetes mellitus are both cause and consequence. Diabetes mellitus as a risk factor of pancreatic cancer. You can see on the graph along x-axis duration of type 2 diabetes mellitus and along y-axis the hazards relations and ORRR relations occurred. Epidemiological studies have demonstrated that type 2 diabetes mellitus is a risk factor of pancreatic cancer, and many studies in the past 5 years has also proved that T2DM is the cause of PC. It clearly shows that the shorter the duration of T2DM is, the higher the average risk association between pancreatic cancer and type 2 diabetes mellitus are. Even if type 2 diabetes is lost for 20 years, the hazard ratio HR stands for the hazard ratio or odds ratio. OR stands for the odds ratio between them are still greater than 1, thus proving that tritium is the risk factor of the pancreatic cancer. A nested case control study concerning the association between pancreatic cancer and tritium was performed by it was initiated from the health improvement controls. It concluded that a poor adjusted OR was 2.74 in tritium patient with pancreatic neuroendocrine tumors, proving tritium to be a risk factor of pancreatic cancer. In 2019, independent association between inflammatory potential of diet, cigarette smoking, and long-standing T2DM less than 5 years in relation to risk factor of pancreatic cancer. The study was composed of 817 cases and 1756 controls. It revealed a 3.09-fold increase in risk of pancreatic associated with long-standing T2DM compared to non-diabetics, and a 2.54-fold increase. Odds ratio is equal to 2.54, 95% caloric is equal to 1.87 minus 3.46 with the more pro-inflammatory diet, and a 3.40-fold increase with current smokers. In 2020, a study to find out the association between T2DM and PC in China. The prospective study recruited 512,000 adults aged 30 to 79 years from 10 diverse areas of China from 2004 to 2008, which was further meta-analyzed with 22 publication prospective studies, and the result as shown in the paragraph. In 2021, a study concerning the relationship between recent onset diabetes and pancreatic cancer incidence in African Americans and Latinos in multi-ethnic cohort, which included 408,995 African Americans and Latinos without prior of T2DM and PC. Let's move towards the mechanism of T2DM associated pancreatic cancer. The mechanism of associated between diabetes mellitus and pancreatic cancer were complex, which included IR, hyperinsulinemia, hyperglycemia, and last one is chronic inflammation. Let's discuss IR and hyperinsulinemia first. The characteristics in patients with T2DM are IR with ensuring hyperinsulinemia and high levels of insulin like growth factor IGF-1. In T2DM, IR can result in the hyperinsulinemia by means of serine phosphorylation of insulin receptor substrate proteins, which can activate some kinases such as PKC and mammalian target of rapamycin. MTOR stands for the rapamycin complex, thus involved in the downregulation of insulin signaling. And insulin reduces the hepatic production of IGF, insulin growth factor, and IGF binding protein, whose affinity was high for both IGF-1 and IGF-2, thus increasing levels of free circulating physiological active IGF-1. The majority of cancer cells express insulin and insulin like growth factor 1 receptors, which are members of tyrosine kinase class of membrane receptors and are homologous to oncogenes of tyrosine kinase class. Both the IGF and insulin receptor are complex molecules. Each gene product is processed extensively and finally forms glycosylated alpha chains and beta chains that associated to form a half receptor. The two half receptors associated to form a holoreceptor and heterodimer hybrid receptors are composed of a half insulin receptor and half IGF. Besides, the insulin receptor exists in two splice variant isoforms. The beta isoform recognizes only insulin, while alpha isoform recognizes both insulin and insulin growth factor 2, and it is isoform most commonly expressed by the tumors. When insulin and IGF-1 are combined with their receptors, they can mediate the initiation of signal transduction that activates important intracellular signal pathways including the ROS-ROF mitogen activated protein kinases and phosphoinositide 3 kinases P13K AKT MTOR pathways, which is the rapamycin, which contribute to the development of the pancreatic cancer. You can see on the diagram, the diabetes mellitus consists of insulin, IGF, insulin growth factor 1, hyperglycemia, IR hyperinsulinemia, which is the high level of the insulin growth factor IGF-1 and IGF-2. The insulin IGF-1 next combine with insulin IGF receptors to form ROS MAPK and P13K, which is the phospholipid, and converted into the AKT and MTOR, which is the ripamycin. The MTOR then further converted into the AMPK and then can be treated by using metformin therapy. And the hyperglycemia, which is the combination of TGF beta 1 and AGE, is converted into the E-cadherin and then treated by using metformin therapy, which is the pancreatic cancer. And the hyperinsulinemia, which is the chronic inflammation, combination of cytokines and TME, which is converted into the apoptosis and then converted in pancreatic cancer treated by using the metformin therapy. Second stage is the hyperglycemia. In patients with T2DM, the occurrence of hyperglycemia is not only as a result of promoting IR, but also because of decreasing insulin outcome via pancreatic beta cells. Prospective cohort and case control studies showed that hyperglycemia was associated with increased free radical formation and might result in the development of advanced glycation end products that could increase inflammation. AGEs are composed of heterogeneous group of compounds that accumulate in tissues of aging individuals and at an accelerated rate in diabetic subjects, which is due to the mechanisms including increased carbohydrate and lipid substrate availability, oxidative and non-oxidative conditions favoring the glycation process, and impaired detoxification. This is the cohort study to find out the tuning promoting role of the AGE carbomethylsilane CML, which was a major AGE found in vivo and known as RAGE ligand in human PDAC cell lines in 2018. Now discuss about the discussion part. Let's discuss relationship between drug therapy for type 2 diabetes mellitus and pancreatic cancer. The first one is the metformin therapy. Metformin is the cornerstone in the treatment of type 2 diabetes mellitus. Retrospective studies have concluded a survival benefit in diabetic patients with pancreatic cancer treated with metformin, and lots of studies and researches have been made to illuminate The magnitude of metformin risk reduction of pancreatic cancer in the past 5 years, although there is a definitely contradictory evidence in the literature, but it seems clear that in some patients metformin can decrease the risk of pancreatic cancer. Consequently, metformin may prevent the development of the malignant lesions and holds promise to be an anti-cancer agent. The current consensus of mechanism that metformin can decrease the risk of pancreatic cancer as metformin activates the liver kinases beta 1 adenosine monophosphate protein activated kinase pathway, which can not only facilitate cellular energy production and restrain hepatic glucose production but also inhibit the signaling mechanism regulating cellular proliferation as a non-tumor suppressor, and the rapamycin mTOR complex 1 and disrupt crosstalk between insulin IGF factor 1 receptors and G protein coupled receptor, which regulate protein synthesis and application. What is more, metformin play important role in pancreatic cancer stem cells through the rapamycin pathway, which is evidenced by decreasing cancer stem cells makers such as CD44, CD133, which is the cancer cell, aldehyde dehydrogenase type 1, epithelial adhesion molecule, and so on. So metformin therapy is an excellent therapy to reduce the risk of pancreatic cancer in type 2 diabetes mellitus patient. Next therapy is the insulin therapy is often necessary for long-standing TTDM, and there were abundant studies and researches showing that insulin therapy was associated with higher risk of pancreatic cancer because insulin itself may directly increase pancreatic cancer risk. Insulin has potentially mitogenic and anti-apoptotic effects on cultured cancer cells by active waiting off the insulin growth factor 1 pathway. Moreover, insulin induces phosphorylation of ERK and AKT, which suggested that insulin can stimulate the ROS of MAPK and P13K pathways. So, insulin therapy increases the risk of pancreatic cancer, and metformin therapy decreases the risk of pancreatic cancer. The last portion is conclusion. Pancreatic cancer is highly aggressive and lethal malignant, and type 2 diabetes has a wide range of morbidities, and it can be screening morbidity and mortality for patients occurs with pancreatic cancer, and it can be screening tool in the high risk of case of pancreatic cancer to determine the treatment modality and prognosis. So pancreatic cancer in type 2 diabetes mellitus can be treated by using metformin therapy, which decreases the risk, and it is the anti-cancer agent. The insulin therapy increases the risk of pancreatic cancer and is used for the treatment of the apoptosis. So metformin therapy is an excellent therapy to reduce the risk of the pancreatic cancer. These are the references. You guys have any question, then you can comment me and I will try my best to answer you. Thank you very much.